Welcome to the Healthusiasm podcast, live from Health Europe. We are a panel discussion on trends and innovations in health and self-care. My name is Christophe Jauquet. I'm the author of the Healthusiasm books and a professional keynote speaker on health, business, and technology. Every week, I discuss with a panel of experts the positive changes that are shaping our health and happiness. And for this live discussion, we are together. So normally I would say calling in from Barcelona, but it's this time sitting next to me is our digital health connector, Aline Noizet.
Hola.
We have from Scotland, but also in Amsterdam, hlth.Europe conference from Scotland, living near Brighton, in Amsterdam, medical expert in digital innovation, Dr. Keith Grimes.
Hello, everybody.
And came all the way from Belgium, Ghent, Belgium, human experience expert, Mo Zouina.
Hello, Chris.
So hello, guys. This is after 2 years. It's been 2 years since we started the podcast. This is the first time that we actually sit together and have a real life conversation. So I'm curious how this will go. I'm curious how the listeners will like it. But how do you like so far the conference? How you've been here all day?
Yeah, I think for me, I'm a freshman in terms of these events. I've learned a lot from Aline, which is, I think, a stop and go experience. When you walk with Aline on such a conference, you're not able to do 10 meters without she stopping to meet someone. So she's incredibly well, skilled at what she does.
Digital health connector. Yeah.
Absolutely. 3.0.
I walk the talk.
You walk the talk, you talk the walk, really. But I think what I like about this, since it's the first time it's organized, is the scale, because there's not that many people. So connecting is really, really easy.
It's fun as well. I mean, you meet so many people that you know, right?
Yeah, I mean, one of the really, really lovely things about this, I went to health in the US, and there's a lot of the DNA of what they do is still here as well. You know, it feels like a combination of lots of really interesting exhibitors, really interesting speakers, and a lot of people in the health tech game. But there's also a lot of sort of self-care in there as well. I've had a beard trim, I've had a massage, I've had all the food and drink as well. So yes, absolutely.
Already?
I know. I took advantage of it all. But the nice thing about all of those, apart from looking fantastic, is that you also get the opportunity to connect with people and not worry about the fact that you have to queue for coffee or food or anything like that. It's all there. So it allows you to kind of relax into the event quite nicely. And I think you're right. It's a wee bit quieter than it was maybe in the American event, but this is its first year, and still there's a lot of very familiar faces. So like Ali, I'm maybe not being stopped quite as often as Aline, but I'm certainly bumping into people very frequently. So there's an element of sort of coming together and celebration as well as seeing some things new. It's really enjoyable.
Yeah, I love it. And you're not tired of speaking it, which is nice already. So tell me, there's a full agenda as well. I think, how many stages are there?
5 big ones, no? And small ones. Yeah.
At least 5. And then there's all the little ones scattered around as well. And then all the side events.
But maybe if I can add something before we move on to that, like what I like about health, what I like in the US, and I find the same here. For me, it sweats innovation. It's like innovation in action, everything that they do. And you were talking about stages, and that's something that I really like. Like they make every stage very unique, very special in terms of design. And like, for instance, the sound stage, there's a piano and there's a guy playing live piano between sessions. I think that's amazing. So they're really those small touches that makes you feel good.
Which means that at a certain point, listener, if suddenly you hear a piano, it is very possible because it might reach our booth here. We're not entirely encapsulated, I think. We're not safe from the outside sound anyway.
But I was hearing the piano now. That's why it came to mind. Yeah, a few minutes ago.
Okay.
Yeah.
Lovely. So yeah, lots of things happening. Lots of stages, as we say. Any session in particular you've went to that you want to share something about? We're looking for Healthusiasm, things that you really felt that make you feel like, oh, this is happening. This is nice. I really found this interesting. Aline?
Yeah, so I went to the sleep session this morning on the sound stage with the live piano.
The sleep session, you have to explain that. The sleep session.
So it's not about sleeping. It was really talking about the different technologies that can help track sleep and actually impact the patient and the users. So my friend Guillaume Marchand was on stage. He's a psychiatrist by training and recently became a sleep doctor. So he's seeing patients to help them train. And the conversation was around that, like, is he using some technologies with his patients? He was saying it's actually hard for him because the different technologies, they are using different scores, for instance. And for them, for a healthcare professional, it doesn't really make sense. And they say that they are missing like raw data that a healthcare professional can use to understand or to make some recommendation to the patients. And something that I also find really interesting in that session, and I can relate to that, sometimes like monitoring your sleep can actually be counterproductive.
I agree.
Because you can get more stressed. Like, oh my God, I didn't sleep enough. Like, I'm going to be tired. I won't be able to go on my day. So yeah, I thought that was a very, very interesting comment.
Yeah, I went there as well, specifically because one of the things that I track most of my health is definitely my sleep, because I think it has such a major impact, and I'm not always sure whether I sleep enough or whether I go to bed early enough. And this is the reason why I actually do it. What I do felt during the session, there were two things. One is there was a little bit of tension between the ones that provide the solutions and the ones that were doctors or used to be doctors, because of the reason that you said, right? I mean, what does a sleep score mean, and how do we go about it? And I was a little bit saddened by it in the sense that I felt like, I mean, we should be embracing the fact that so many people want to track their sleep, I guess, and that I was missing. Yeah.
Yeah, I think one of the things that maybe drives that, so I'm speaking from a sort of doctor's perspective here, is that when patients have sleep disorders, they can get very, very focused on the quality of their sleep, counting when they go off to sleep, when they wake up, all those kind of things. And that can be really counterproductive for them. It can be quite difficult to get very, very anxious about it. And I assume that doctors working in sleep medicine or sleep clinics will see people that maybe at the more extreme ends. They've probably been very sensitized to people that are very hyper vigilant. So one of the things that, speaking as a doctor, one of the things that maybe you were picking up in that tension is that doctors working with patients with insomnia or sleep disorders, or maybe in sleep clinics, will be very, very used to seeing patients who get very, very focused on the sort of fine details of when they go to sleep and when they wake up. And I think the idea that you have apps that help them focus on that a little bit more is probably like ground into them in a great sort of detail. And I think that's probably hard to separate out. So maybe that's where they were coming from. But I think it's not helpful if they're not engaging with the providers.
Yeah, I think you're totally right. And I think it's also fair enough to say that many physicians they're not particularly trained to deal with these kind of solutions as well. So this is all very new, and it's hard to make relevant of the data that is collected in there for some reasons.
What's interesting to notice is that the obsession with having the right sleep, so not sleeping well, is kind of a medical condition maybe. And the fact that Europe...
Not necessarily.
Yeah, I don't know. But one disease invites the other. And there's a name, it's called orthosomnia, where you're obsessed with finding the right sleep. So one condition can hide another, as we can say, which is kind of an endless domino effect of mental health problems. And yeah, I see that. The first thing I do is also look, did I sleep well? And what we tend to forget is linking, how do I feel with, oh, yes, I do feel like that. And it's confirmed in my app. So we kind of take feeling out. So I think what is nice is the closed loop that apps could give you to make the app redundant in a time, because you will know in the morning. We get the impression that we don't know ourselves how we slept until we see it on the app. It's a bit like Strava,
And this, I think, sorry, go ahead, Aline.
Sorry, no, but I find that sometimes it's the reverse for me. With my Aura ring, I feel that I've slept well, and my Aura is telling me the reverse. So sometimes I couldn't understand what they were saying this morning with like having just one number that doesn't really make sense. If it doesn't make sense for me as a user and consumer, I can understand how it doesn't make sense for healthcare professionals.
Well, typically speaking, these consumer devices are not ideal anyway to measure exactly how deep you slept and how good you slept. It's an indicator, and over time it might be indicatively right, but we need to be very cautious with that. But to piggybacking on what Mo was saying is that I think there's indeed a major danger that we are facing here, and definitely with AI it will become even better, is that we forget to feel. I mean, it's like we only feel what we see or what we can read from things, and there's this trend that I'm thinking about and writing about right now, which is called bewildering, where we try to go back to wildlife and in a sense that, just let things go and feel what we feel and eat when we're hungry, not when we have to, and not just depend on what AI is telling us, but really go through the emotions and the natural feeling. And I think there's a danger with all the technology that is coming at an increasing speed to us. We need to make sure that we keep that to us.
There's an interesting idea. Before you open your app, you could assess your own sleep and then see if there's a delta.
Yeah.
If there's a delta or not. And then ideally, of course, it's a bit like Tinder. Tinder doesn't exist by having successful relationships. Tinder exists by people looking for successful relationships. So from the moment people will have their ideal sleep, the technology becomes obsolete. So maybe that is also integrated in the technology so that you keep on being dependent on the technology. So because it's counterintuitive, helping you sleep better makes the technology obsolete. So I don't know in terms of ethics if there's something built in it to kind of re-challenge your assumptions from time to time and say, you think you slept well, but you didn't because we tell you so. Anyway, that's maybe a conspiracy theory.
Yeah, I was going to say, it sounds like a conspiracy theory about big sleep trying to challenge you and dark patterns in sleep tracking. But there's an element to it. I know it's one of the more contentious areas in the sort of quantification side of things. Absolutely. So it's interesting you picked it up in the talk earlier on.
But there was also something I want to share, a nice story from this morning. They were sharing the case of a lady, 80 years old. She's been using or taking sleep pill for 50 years, 50. And so the startup Hello Better was an app to help people sleep. She tried that app. And after 50 years of taking pills, she stopped. And now she's only using the app. So maybe more what you were saying, like, maybe now she's going to get dependent on the technology, but she's off the pills. And I think it's an amazing story. Now she's sleeping well thanks to the app.
Great. Now, moving on from sleep before our listeners fall asleep. Keith, did you see any session that you really liked or that you want to share or that had some healthusiasm in it?
Yeah, well, I suppose it won't be too surprising for anyone that I've been very, very enthusiastic about seeing how people are engaging with artificial intelligence. Of course, it's a deep obsession of mine and many people. And so I suppose the first healthusiasm I had was the AI in the NHS panel, which was yesterday. And it wasn't because I saw anything, because I couldn't get in. It was so full. The room was overflowing and there were people standing in the corridor. So I didn't see anything, but it made my heart warm to see that people were interested about AI and how it's being used in the National Health Service where I'm from. But if I talk about one of the sessions that I went to, I did go to a very interesting one earlier on today on ChatGPT in the hospital. And what was interesting about that one is they had a number of people on the panel talking about real world applications of ChatGPT. ChatGPT, by that, they were talking about any of the large language models. They had someone from Microsoft, from Nuance talking, and he was talking about ambient documentation and about the impact that has in freeing up time for doctors to be able to speak to their patients. There was a radiologist there who was talking about how AI and convolutional models have been very helpful with radiology, but now they're looking at things like large language models to make the act of writing reports, the things that radiologists generally don't like very much.
I got a story on that.
Yeah. And then Harris Schwabe was there from Newton's Tree talking about how there's ways of operationalizing inside hospitals. And then finally, someone from Philips talking about, again, freeing up time. And it was really, really enthusing for me to hear people, first of all, talking about the use of AI, specifically about freeing time to leave more time for humans to connect with humans, a theme that I've been going on about for a little while. I'm not alone in this, but it is nice to hear that. And also a very sensible approach to the use of AI, and not over-promising, but starting with some of what they called the low-hanging fruit, the easy wins, about how we can use it for administrative support, and then build towards more confident use cases going forward. I thought that was helpful. But the biggest cheer that I had was at least two of the panelists said that they wanted doctors and healthcare professionals to learn how to prompt, to learn how to instruct these models, to start taking control of AI for themselves. Now, I'm a big believer that we're going to get the most out of the technology when we use it ourselves and not wait for other people to package it up in a useful way. Now, there are consequences of that, but you still want to be able to do that. So there was a lot in there that I found very, very positive.
And so let me just ask you a question. Physicians, I mean, there's a couple of things. I mean, it's good to see an administrative, and I think that those are the quick wins, as you say. But are physicians ready to actually, two things. Are they ready to work with artificial intelligence easily because they're not trained for it? And do they have the time to actually go to that learning curve to actually do it? Those are the two quick things that I always have to think of when you think of digital innovation. We need it. It might come. But where are we, and how quick will this will this be the one that goes quick or not?
No, it's not going to go quick. It never goes quickly. However, what I think was really interesting about it is that point about clinicians being ready to apply the technology was made a few times. And in particular, there's this situation right now where people might use, a radiologist might use AI, and they might use it to assist in the process of interpreting some of their x-rays, but they haven't even been trained as to how the AI might work in depth. Now, they don't need to know in great depth, in the same way that a radiologist doesn't need to know exactly how an MRI works, right down to the sort of nuclear medicine side of things, but they still need to know how to use it as a safe tool. We don't have that just yet. And it's really important that we do so, because one of the trends is that models are being produced and then passed on to the doctors and the clinicians, and then they are assuming the liability, like the entire liability, not only for any mistakes that they make, but actually any mistakes that the products make. They're there to check it too. And this is putting a lot of pressure on. So it was nice to hear about people talking about how we should do this now, or how we should train people. Now, how do we get people ready for this? That is hard. I approach it by trying to train doctors and people that I speak to about how to use AI themselves, maybe not even in healthcare, so they know how to use it in their personal lives, because the lessons they learn there can be transferred back. And I think that's maybe a good approach, where they can use it for small things, maybe in their own life, and then for small things in their professional practice, and then over time coming in to using it clinically. I think that might be the way in.
Yeah. Christophe, when you said, are they ready to adopt it? What does ready mean? So first of all, are they willing to use it? Are they willing to trust it? Are they ready to interpret it and know exactly where it has the highest value? Because I think there's been a very important shift where we went from a culture of knowledge of answers to a culture of knowledge of questions. So there's a new skill required. As Keith is saying, if he's training people just to use AI, we were fascinated by the answers. Today, we are challenged by the quality of our questions, right? So I think it's also a new knowledge and a new skill. So there's different levels: trust, adoption, skill, interpretation, but also a completely different shift from a culture of answers to being good at asking questions and prompts. And I think, as Keith said, we're not there yet, because there's the attitude, there's the skill, there's the time and availability. So that's maybe a side note on that.
I think prompts will disappear at some point, because it will be all behind the scenes anyhow. So I think asking the questions, you're right, definitely for a couple of next couple of years, but they will be automated. They will be in back whatsoever.
Yeah, but in the meantime, we're there, and it kind of brings a sense of inertia to adoptions, because the technology companies will be further on, and the HCPs won't have set the first or the second step.
Yeah, it's the difference between having something pushed onto you versus pulling it onto you as well. And any situation where it's being pushed is less likely to succeed, at least in my experience. So how do you generate that pull? That pull is in part people getting a better understanding. And I think that understanding doesn't necessarily have to come from using AI in healthcare. It can be in any other area, and then brought back in with there's a small delta that you then fill in.
Maybe for a quick anecdote, I was laughing when you were talking about the radiologists and the reports that they are making. But there was this hospital, won't say any names, that suddenly fired all of their radiologists at once. Bam. There was an internal audit, and apparently the conclusion was that many of the conclusions in the report, but also the quality of the report itself, was just substandard. And so they just fired them all at once. Like the whole hospital does not have any radiologists anymore. And I think the way that I interpret it is that you can only analyze this really, efficiently with AI. So probably AI just said somehow, oh, this is really, really bad. And there were lots of complaints apparently in the hospital as well.
Yeah, but I don't know if you knew the news afterwards, is that the margin error wasn't as big as they thought it was.
Oh, yeah.
But the question is, what was the standard? So it was kind of average. But does that mean that the error margin was really high? Right? So what was the standard? So apparently the organization that defended the radiology said that the answers were, from an industry standard, weren't very far off. But then the question is, what is the industry standard?
Yeah, that's what I was about to say. And so maybe that will be increased with AI when it is adopted anyway. So
Yeah, I mean, one of the really interesting things, amongst the many interesting things about AI, is how it's forcing us to look again at how well we perform. Artificial intelligence, what does it mean for me to be intelligent? What is my bias? What is my performance in this task?
Right.
And I think the consequence of that, as we say, well, we want the AI to be unbiased. So how biased is it? And then the natural question is, how biased are we? And then we have to face up to that.
But AI cannot be unbiased because everything AI uses it was created by humans. It is by default biased.
True.
There is no intelligence really. The only intelligence is about the capability to process data in a way that we couldn't do humanly. But everything that is used, do you believe that there's new intelligence created, or is it new insights created on quantities of data that were available but not humanly, processed in some way?
This is meta. This is
starting to get quite deep.
Yeah.
This is getting into the whole remix thing. But
Go to the next topic.
Please remove more. Aline, did you see any other topic today that you think that was marvelous? Did you see the one of La Poste? Did you see it?
No, I missed.
I missed it too. But I find it, well, it's pretty interesting. I took some notes because I was in the session where they say the new healthcare players, which was with Uber Health, Walmart, and La Poste. And there I heard a little bit about it, and I'm trying to open my iPad in the meantime. Basically so La Poste, the posts services in France, decided to go all the way in health. Specifically, they say they have 3 business models specifically inside, which is one, they will provide digital solutions. So I didn't understand really well how it was called. I think it was open site or something. I'm not quite sure what it is, but it's an open ecosystem where they want to gather the right solutions within their La Poste solution, let's say. They want to make sure that all the data can flow in between all these stakeholders and in between all these, startups. Wow. This is exactly what we all want and what has been tried before. And they want to focus on population health. So this is, when I heard it, I missed the announcement. It was like 10 minutes in between things. So I was very sad when people were talking about it here on the floor. And then I heard a little bit about it later, but it was really interesting to see what they could do. There were some examples when they said, there's so many, post office guys that go from door to door who meet elderly people that can actually do a lot of things when they are face to face with these people. And so when we have these solutions and when we can gather these solutions, we can really try to find real world evidence, get to real world outcomes. I have to say it was a little bit, buzzword, and we are new into health, and it felt a little bit naive, but it may have more to do with the person that was selling it, which was a higher person who may not have a lot of experience within health, but it was so remarkable. La Poste going into health, digital health.
But they've been active for many years already. So they have a division called DocaPost, where they're really doing solution focused on health. They are also, I think that's not very well known, but they are the leader in like data repository in France and like in the world, like to secure your data. Yeah. And also that service that you were mentioning, and I think it's really great when let's imagine I live in Barcelona, my parents are in France, and if my parents are alone, I can ask La Poste to have the postman go and see my parents once a week to check on them, to go to the house. And that makes sense. It's like that idea of you really take the patient journey. Like the postman will go anywhere to deliver the post. And I think it's brilliant. So no, they're really doing a lot of things. They deserve more visibility around what they're doing.
Well, what I like about it, I worked with the Post in Belgium as well, and they were struggling because very often the post office, how do you call it? The post delivery guy?
Mailman?
The mailman. Obviously.
The male person.
The mail.
He, she, it, we.
Okay. The mail person. They were looking for solutions because they have a lot of people, but they didn't know what to bring. So it's an interesting evolution, Keith.
Yeah, I think it's fascinating, and what a great idea to use an existing service and slightly repurpose it to provide that function. On a slightly sort of more negative note, in the UK, we're seeing a reduction in our postal service. This sort of very old service has taken a lot of damage recently, in part to do with how it dealt with its postmasters. But separate to that, they're delivering post less frequently. And we're actually seeing, oddly enough, Amazon and other delivery companies doing far more in the way of contact. So actually, if that's an observation from the UK. However, what you've said about La Poste, I can see potentially the delivery drivers, who tend to be the same people in an area as well, performing that service. And what a great idea to get someone to check in. That was, I remember as a doctor sometimes asking, finding out from the mail person. They're the ones that would often say, no one's picking up the mail. So yeah, flagging ill health in one of the house residents.
No, but I think La Poste is really, for me, a great example of company who manage to reinvent themselves, because their services become not completely obsolete, but not as relevant as it used to be, because things are evolving. Now people are sending emails, not mails anymore, not as much. But they really did a great job. It's really a reference company for me in that sense.
Yeah, maybe a last thing. Walmart, who has also in-home delivery, where you get access to the houses, they, it's easy. They come in with wearables and cameras in terms of ethics and compliance, and you could have the things really delivered to your fridge, right? So I think I love the equation done by the behavioral scientist, BJ Fogg, which says behavior is motivations times ability times trigger. And we overestimate motivation, but ability, if you're there and you're already there. There's a lot of things you can pile onto things because you're already there. You could add that to the service and you can enrich that service, just like Uber did Uber Health, having people go to the pharmacy to get their prescription and talk to a pharmacist because they already did it. So I think that's really interesting. And that kind of segues of where we are right now. I see too much fragmentation and too little integration. I was thinking of all these entrepreneurs here. They're really courageous by trying to cater to a very small part of the patient journey or the health journey. I think it's really tough and very courageous for them to be. And because you didn't ask me, so I'll introduce myself. The thing I found most interesting in the keynote here today was Karen De Silva.
Just give me 2 minutes. I mean, we were
No, but I'll take the lead. I'm fine with it. I think all these companies should be humbled by a mogul like Google saying, we're not doing health separately. We're doing health where we're already operating within YouTube, within Google, within Gemini and things like that. We're just adding health to our proposition within existing products. And I feel sometimes bad for all these companies that are trying to launch something to cater to a very small thing. And I think for me, innovation is more integration of what already exists in delivering an experience that kind of makes sense, that is also more complete than trying to cater to something fragmented. And I think it's very challenging, and it's amazing how they can still get VC to invest in these things. While I think we should be humbled by a player like Google, just say, we're just adding it to what we're already doing because people are already coming to that place, right?
So I'll push back a wee bit on that and say, it's easy for someone at Google who kind of own so much of that access to add that little bit. I take your point, but they still, it's maybe easier for them at that point to add like that small extra thing. But I agree with you in terms of the startups. They're setting themselves up to try and find some small area, some small crack in the wall that they can climb up. But by doing so in a way that they can defend themselves from other people to utilize that same crack, they're making themselves separate and vulnerable. It's interesting you're talking about the integrated service. When I worked more in the out of hours service and I was visiting patients at home, I often say that the biggest difference that I made wasn't so much the medical work, but because I'm tall, I would often change the light bulbs in the houses when I was there, because I'd be in there and there'd be an older person and the room was dark and a trip hazard. And then they said, while I'm here, do you want me to change this light bulb? I changed a lot of light bulbs and I think I stopped a lot of falls. So I think adding extra services where it's appropriate makes a big difference.
Yeah. And to piggyback on all three of the things that you just said, Maud, one was, we were talking about La Poste. We were talking about, the fact that we wanted to bring health to where it is needed. There was a session on equity, and there was somebody from the NHS, and she was really, really, really smart. I liked. She was one of the smartest people I saw today. Apart from the woman from NVIDIA, she's called Minal Bakai. I have to look up what she is responsible for. But they were asking, how do you see equity evolving? And she said, well, the one thing that we need to do is stop thinking as health as a separate agency. We need to have all the agencies and the governments working together, because it touches literally everything and everyone. So we need to make sure that, pollution and climate change and food and education and all that, it all comes together and we all think about health, because that is the only way that we can solve equity there. And that, I think, is the ultimate example of holistic equity, and with solutions like the post, who can maybe, help in that regard as well. Any other sessions? I was going to go to you now, Mo, but yeah, well, you already said so. Did anybody go to the Google session? The VP Health of Google.
Yeah, that's what I just addressed.
Was that the Karen? That was the Karen DeSalvo one, yeah?
Karen DeSalvo, yeah.
Yeah.
But I did follow, there was another session actually, which didn't have Karen DeSalvo, but it had Susan Thomas, who's the UK director of Google Health. And there was a Dr. Google talk. And within that, she was there along with Claudia Pastidas from Flow Health, the women's health company, and Dan Nareth from Ada, and one other person, I'm sorry to remember her name just now. And they talked a great deal about the importance of information and how equity of access to information has really accelerated self-care and started to change the dynamic. But the important thing about that was that the quality of the information, the accuracy of the information was key. So each of them working in separate areas, from Google, from Flow, and from Ada Health, which is has a symptom checker and collects this information, talked about different aspects. That was very, very interesting. But there is a theme, and Aline, I don't know if you've seen this as well, and maybe some others have heard. The theme that keeps getting hit, I've heard a lot and I've written down a lot in my notes, is integration, this sort of integration and in working together. Everyone was talking about it on the stages. Like Dan from Ada was saying, it would be great if we could work with X, and so-and-so was, I'd love to work with Y. And I've heard it on a lot of different stages now.
I agree with that.
Yeah. So have you heard that on the floor as well?
Yeah. Some people are talking about that holistic approach, where us as patients, as consumers, we don't really want to go and see like one person and then another person, but to be able to have access to all of them at once. So they take care of us as one person, because everything is related. And that came back a lot in the different sessions.
Yeah, whether it's called collaboration or integration or holistic. It was very much present in the session with Walmart and Uber Health, and Novo Nordisk was there as well. So it was really nice.
Yeah, I think it's also maybe a refreshing point of view that startups would say, if we could add this to what already exists, we could form kind of an alliance. So as you said, we want to fill up that little part of the crack and then kind of exclude all the rest by taking up, that space, rather than having an approach by saying, okay, this offers that offers that, but that is a void that we can fill if we work together. I think that's also just the word startup means that success is starting and not necessarily achieving or integrating. So maybe we need a new word for startups that kind of redefines what success of a startup is, rather than maybe integrate ups or anything else. But anyway, the fact that they've just started already means success. And I think that's where a lot of companies just start too soon, maybe, or do not look broad enough on how their solution not only would work, but would work with other things together.
Yeah. It's like they're doing something in the corner, but they forget the whole ecosystem. And then maybe you should think first ecosystem and then
exactly
you can fit it in.
Exactly, yeah.
Maybe that's why we see lots of integration and merger those past months. And I think it makes sense. Like, we don't want to reinvent the wheel. Mm-hmm. And we want, as you said, to make the ecosystem stronger and to create collaborations between the different companies.
Do you think that's maybe more of a product of the slightly more financially constrained times that we find ourselves in as well? A positive consequence of this as well is previously, when money was more free flowing, it was easier to say, I'm going to take this money and I'm going to go and fix this myself. But when there's less money around, you start looking around, is there anyone that I can work with to help me? I still have this mission that I want to achieve, but it's harder for me to do so, but working with you and will make it easier. And this is affecting the large players and the small. So potentially that might be contributing to why we're seeing this. But it's this sort of theme that I've heard before, but it sounds slightly different in how it's being presented now.
Yeah, but I think that's also driven by the realization that between the ambition and the reality, there's always too little cash and too little time. So I think it's a reality check on achievement. And I think if you look at health, cells are not isolated, organs are not isolated. The essence of health is collaboration and an ecosystem. And ideally, the solution should also think like that.
Great.
And also, I think keeping the patient and the end consumer in mind, because imagine patient consumer with different comorbidities, like the easier for him, the better. You don't want like 5 solutions. One solution with everything integrating is actually better.
Actually, on that regard, have you been to the patient station here?
I passed by, yeah.
Yeah, that was actually another wonderful thing here is they have a dedicated station where expert patient and patient representatives are available to speak to you about any aspect of what you're doing. And so I went and actually spoke to them earlier on because I've been thinking about how I talk about AI with patients, and I was thinking about how I would communicate that. Took the opportunity to actually speak to an expert group there about my thoughts and had some of the rough edges of what I was going to say knocked off, which was quite good. So that's a lovely thing to see here, actually explicitly called out. Also a company that sort of helps with that service too, but you got to check, people are going to hear this after the event, but it is worthwhile seeing.
Okay, wonderful. Good to know. Maybe just to wrap things up, did you note any quote, some quote that you said, oh, this was really, really good, or that opened my eyes, or I had really this feeling of I need to write this down? Maybe I'll start and give you some time to think of. I think the one that made me smile, definitely because it's very in line with everything that I say around Healthusiasm, was the quote from Google that says, I think the question was related to why is Google into health and where are you going and blah, blah, blah. And she said, yeah, sure, Google is going into health because Google is a life company. So we are everywhere in life and health is everywhere in life. And so we want to enable health, not just the healthcare system. And I was like, wow, this is it. I'll use this in my keynotes for sure. I really like that one. So anybody else got a quote you wanna share?
Yeah, I have a few. So in the sleep session this morning, something I really like. So they were talking about monitoring sleep passively. And they actually referred to the HCPs, healthcare professionals, as guardian angels. And I really like that reference, saying that so they will be passively monitoring us. And if there's an issue, they would be contacting us. And that's where the concept of guardian angels is coming.
Lovely.
Yeah, there's a couple. One that I heard firsthand, and then one that I heard secondhand that made me excited and furious at the same time. So the one that I heard firsthand was from Claudia Pastidas from Flow at the Dr. Google talk. And she used a phrase that I hadn't heard before, which is really good, is that people want to consume snackable information. And the thing about that is that how do we then adapt our healthcare messages in a way that people can snack, because people are used to small bites of information. Now that makes it difficult to talk about complex things, yet we still have a duty to deliver in that particular format. So I thought snackable information was a lovely phrase that I'd heard. And then afterwards, I spoke to a friend of mine who went to a talk that I wasn't able to attend, but he had 2 quotes from it, which he mentioned. And it was about EHRs, electronic health records, and about AI. And the first one was a really nice analogy. He said that at present, AI and electronic health record are like a cake with the tastiest icing, which is the AI, built on an uncooked collapsing sponge, which is the EHR. Talking about the difficulties we have at EHR.
That's a nice quote.
It is. But then there was another quote, which I swore out loud when I heard it, which was from one of the EHR manufacturers who said, clinicians should not be involved in the design and development of EHRs.
Yeah. Put that on a t-shirt.
Yeah, I'll put that on his t-shirt. I wasn't at that talk, and I'm glad, because I would have audibly swore at that. I think that is the most.
No, I was there, by the way.
backward. Oh,
I was
all
there.
right. So did he? Was there any context?
Yeah, there was.
At
There
the
was.
moment, I'm furious.
No.
Bring it
there
back
was a
in.
context. So what he said is that we made the mistake of asking physicians what they need. And then he said, well, if we do that, then we come up with things that maybe are not the best solutions because we don't take into account what they expect, etc. So I felt it more nuanced, and he corrected himself. It was a little bit of a one-liner that he wanted to drop and shock the audience with, and then he came back a little bit and saying that we need to involve them and make sure that we meet their expectations, but just don't start from trying to answer all the needs of what a physician or one physician might say.
I think the failure is in the user research done by that particular person, but I'm feeling a little bit calmer as a result of that.
But the thing is, if I quickly may, is that one of the mistakes that we make in healthcare anyway, and I've said it before and I'll say it again, is that we only focus on the needs and we forget the expectations or the life aspirations. But maybe for EHR that might be different. But I think we need to take into account what do we expect? How do this need to? Not only what does it do, right? And I think that was how I interpreted a little bit. It was not in the same way, but it went into that direction. You got another one, Aline, for us?
Yeah, maybe I want to share something with you that I found interesting. So there was a session on the metabolic health, and they were talking about GLP-1 quite a lot. And something that caught my attention is like they were saying that there will be side effects of GLP-1 that will appear in the coming month. And those side effects will actually create extra costs and to the healthcare system. So the idea of GLP-1 first actually to cut costs, but with those side effects that maybe we were not expecting, they're going to create cost. And so I think it's going to be interesting to see what's happening in the future around this.
I think it's incredible how we can fall in and out of love of innovation so fast. It's incredible. It's incredible. So now with the GLP-1 and things like that. So
I think you could leave out innovation.
Yeah, just new novelty.
No, just we could fall
in and out of it. But that might be maybe personal. But I think the cycle of wow and wah, wah, wah is incredible. We talked about Revit, we talked about Humane.
Yeah.
Now we talk about GLP-1s. And maybe that links to aspirations is we're so eager to find the solution that kind of solves everything. That's the way we look at AI. That's the way we look at GLP-1s. So once again, maybe that's my intervention. People are lazy. And if there's something easy, convenient, we kind of want to kid ourselves always by being not critical enough. And what I'm hearing right now is kind of a COVID 2.0, where everyone just rushed on kind of vaccines as being the hail solution, and then coming back from that and saying, we've looked at it ideally and maybe more in a granular way, and maybe it's not as. So I think from a human behavior point of view and from a social point of view, I think it's really interesting how we can fall in and out of love of things so fast.
But with this here, what I find interesting for me, like I'm really much into personalized medicine. I think that's linked to it because what they were saying is that we're talking a lot about personalizing a dose of like a treatment of a drug. And that's what it's all about. They were saying we need to adapt the dosage of GLP-1. Apparently it's not being done at the moment. You have one and that's it.
Yeah, but there was just a study on maybe people need fewer statins. I don't know if you saw that. It was all over the news. And then, but we have to be careful and things like that. So years of usage has been challenged right now. And I think the speed of how we challenge things is also really interesting.
We're certainly living in a very accelerated culture. I mean, the version that I tell of that one is that, AI comes along and does what appears, generative AI comes along and does these fantastical things. The ability for the human race to take something miraculously different and then about a day later go, well, it's not quite doing it the way that I don't like this. It refused to do this thing. Our ability to sort of normalize our experience is incredible. One of the other things you're talking about that, there was one stand, I took a photo and they were advertising, and their advertisement, it was for a company called Proxymed. And they advertised saying, the first trustworthy and fully scalable non-AI digital assistant for treatment decision-making. And I love the fact that they emphasized that it was not AI.
So what is the red thread, Christophe? Maybe innovation and technology and progress and novelty forgets aspirations, which is kind of the common undercurrent. So maybe we should invite all innovators to tie back to what you say in your book, and I think this could be a really interesting backbone of the way people reason and to create some continuity in value. But maybe that's for you to address in the next podcast or a next keynote.
Or we should invite them to read your book.
Yeah, for sure. But I think it's true. I mean, what I did try to do with aspirations was give something behind to health and happiness. We say we want to be healthy. We say we want to be happy. We say that we need to move more. We say that we need to eat better, etc. But the reason is why. And the aspirations are my version of the answer to that. But maybe to close this session now, I think I have the perfect quote to really end this. And it's maybe a thread throughout, and the red thread throughout the whole event of today as well, is that, where is it? Here it goes. Listen very well. So every moment in life is a moment for lifelong care. And I really felt that today because there were a lot of ideas, a lot of moments in our life that were discussed, from La Poste to sleeping to meeting patients, to a lot of solutions everywhere, in whether it is in the office of a physician or whether it is at home, I think, or in an Uber, which was talked as well about today. So there's a lot of moments in life where we really can take care of our own health. And I think that is what Healthusiasm is all about. And I think with this final words, I'd like to wrap this Healthusiasm podcast for this week. So thank you for listening live from the Health Europe conference. If you like this show, don't forget to hit the subscribe button on your favorite podcast platform. You can also visit healthusiasm.com to discover the other episodes. Subscribe to the newsletter and learn more about our panelists. For now, I'd like to thank our panelists for their Healthusiasm. Thank you, Aline Noizet. Thank you, Dr. Keith Grimes, and Mo Zuina, of course. My name is Christophe Jauquet. We are the Healthusiasm panel, and we'd love to see you again next week for some more Healthusiasm.